On behalf of Maribel, Tristan, Andrea Smith, and myself, Jacob Keith, we would like to welcome you to our presentation of hyponatremia. For clarity, hypernatremia is the opposite of hyponatremia, and it is characterized by high sodium levels. On the other hand, hyponatremia is a condition where the blood volume of the electrolyte sodium in the extracellular fluid is dangerously low. A healthy sodium level is between 135 and 145 millimoles per liter, and a person is considered to be hyponatremic if their blood sodium falls to below 135 millimoles per liter. There is no recorded date of discovery for hyponatremia, nor a discoverer is credited. Origin of name. Hyponatremia is made up of two words, hypo meaning low, and natrium, the Latin name for sodium. Body systems affected. Hyponatremia affects the nervous system. For example, when hypoosmolality, which is characterized by excess water intake being put into the bloodstream via absorption too fast by the small intestine, arises at a rate that exceeds the brain's ability to regulate its volume by electrolyte losses, such as in acute hyponatremia. Brain edema may occur, and the patient can develop severe neurological signs and symptoms, possibly leading to death for brain herniation. Cause and mechanism of affliction. Hyponatremia can result from multiple diseases that often affect the lungs, liver or brain, heart problems like congestive heart failure or medications. Some symptoms of hyponatremia include muscle cramps or weakness, nausea and vomiting, low energy, headaches, and seizures. Diagnosis criteria for hyponatremia. A doctor can diagnose hyponatremia with blood tests that measure the amount of sodium in the bloodstream. The doctor will also perform a physical examination to detect the severity and the cause of hyponatremia. Available tests for hyponatremia. Some of the tests that may be run to help determine which form of hyponatremia a person has include blood urea, plasma, and urine osmolality for dilutional hyponatremia, blood glucose, which may be raised in cases of hyponatremia, thyroid function tests, and urine sodium level tests may also be used. Population most affected. Anyone can develop hyponatremia. As stated before, it is more likely to happen in people living with certain diseases that affect the lungs, liver, or brain, and/or have kidney failure or congestive heart disease. Risk and environmental factors. Hyponatremia causes water to move out of the bloodstream and into body cells, including brain cells, and can cause confusion. Complications of hyponatremia can include mental status change, seizures, coma, or even death. Available treatments for hyponatremia. If a person has mild symptoms, the doctor can make small adjustments to the patient's therapy to correct the problem. This usually involves restricting water intake, adjusting medication, and removing or treating the causes using long-term or short-term therapy. People with moderate to severe symptoms of hyponatremia require medical evaluation and treatment. The sickest patients may have to get sodium intravenously, straight into a vein, and limit water consumption. Risk of treatment for hyponatremia. Many people recover fully from hyponatremia, with future problems prevented and/or managed. Average cost of treatment. The direct costs of treating hyponatremia in the U.S. on an annual basis were estimated to range between $1.6 and $3.6 billion. Hospitalization cost is accounted for approximately 70% of the total cost of the illness, at $1.1 billion to $2.5 billion, or $1,528 to $3,441 per patient. Follow-up treatment costs $495 per patient. Dietary restrictions of hyponatremia. Concerning hyponatremia, first-line treatment consists of a patient placed on fluid restriction and an intravenous infusion including 0.9% of hypertonic saline. This diagram illustrates the dangerous effects of hyponatremia on the brain, lungs, and bones. Preventive strategies for hyponatremia. Indicators that can help judge a person's water intake to prevent hyponatremia include their thirst level and the color of their urine. If they are not thirsty and their urine is pale yellow in color, then they are well hydrated and should not drink any more as it can lead to overhydration. For heavy physical activities and exercise sessions, drinks containing electrolytes may be preferred to replenish the sodium and reduce the risk of hyponatremia. This concludes our presentation about hyponatremia.